health insurance personalized. This is Consumer's Doctor on the behalf of foremost organization. Medicare. Let's talk about how this whole Medicare thing started. What the history behind Medicare, how the government, so-called, as you all know, Medicare is a government subsidized program, how the government got involved in the healthcare, so-called healthcare delivery. Looking into it, we have been talking quite a bit. I know there is a lot of folks would like to see Medicare for all, so-called public option. Public option. You know, the most of the people in the country, especially under 65, they do not know what Medicare is. They do not know what the Medicare is. They may have a parent, relative, or uncle under Medicare. They all seem to like it. So, what is the big deal? Let's talk about it. Let's talk about Medicare. What it is, what it is not, and what could it be in future. Let's look into it, folks. That is very important. What are the roots of Medicare? How did it all start? It looks rather strange for those of us who have been in working population, getting insurance from our employer. Originally, individuals were buying it, but employer buying individual health insurance policy. It all started in 1930s, folks, prior to the Depression. Baylor University Hospital was covering the costs of the hospital care. And in the case of Baylor University in 1929, their receipts dropped from $236 to $59 per patient in 1930s. This is prior to the Depression. Nearly 80% drop. A large decrease in the amount of money they were able to collect from the patients. There were those who were coming through the doors. And occupancy dropped from 70 to 60%. But remember, folks, this is just prior to the Depression. So total contributions to Baylor University Hospital went down by 2/3. They were trying to figure out what to do. How could they serve poor population out there, those who can't pay? To encounter that problem, they came with a plan. They had no idea, but they came with a plan anyway. To have a steady stream of revenue for this hospital. It is less than what you would have expected in normal times. At least steady stream of revenue coming into the hospital. So they came up with a plan in 1929. That plan was established to provide a prepaid hospital care. Prepaid hospital care, which was originally started by a guy by the name Justin Ford Kimball in Dallas, Texas. He developed a prototype and named it as a Blue Plan, which are really prepaid plans, prepaid model. You would be asking, what did they come up with? You would be surprised to know, folks. You would be surprised to know how it all started to keep the hospital afloat with steady revenue. What the hospital came up with is called this is a Baylor, this so-called Baylor plan. They came up with a prepaid plan of a monthly rate of 50 cents, folks, 50 cents a month. 50 cents a month from every person surrounding that area. If you look at that, if you adjust the amount of inflation today, it is still worth only $7 a month, folks. $7 a month, even with 1,000% increase. Yet, it pale in comparison to today's cost of obviously going into the hospital can be extremely expensive. So the Baylor plan was an immediate success. And they were enrolling employees into this prepaid plan, and everybody was eager to join. And all the professions, including the teachers across the city, participated. That's how they named it as Blue Cross at that time. This was Blue Cross, original Blue Cross. It's interesting how it to go back and look at it. That model spread to other hospitals in 1932. Similar plan was established in Sacramento, California. Sacramento, California in 1932. However, unlike the Baylor plan, which covered the hospital services of a single hospital, Sacramento plan covered services at any hospitals in the area. Roughly around 26 hospitals would accept the same plan, and they would service the same plan. So-called prepaid plan. They were not called as an insurance. They were called as a prepaid Blue Cross. That contract among the other hospitals. So everybody was participating. In just 10 years, folks, in 10 years, enrollment of these plans grew from 1,300 lives to 3 million. 3 million. So only major downfall of this Baylor plan, Baylor Blue Cross health plan, so-called prepaid plan, it covered only hospital services, folks. It only covered hospitals. So what happens next? Then Blue Shield comes into play. It's remarkably similar story, folks. Blue Shield concept grew out of a lumber and mining camps of Pacific Northwest. Employers wanted to provide medical care for their workers. They decided with physicians who were paid monthly fee for their services. Those contracts with the physician led to a bureau called Medical Service Bureau, which physicians were a part of this bureau. The group of physicians joined this bureau. They were able to take care of the clients from this medical service bureau. So ultimately, so-called Blue Cross and Blue Shield companies merged. They formed Blue Cross and Blue Shield as we know of today. As we know of today. The basically what the providers try to do is fix an amount of a budget from a population to provide these services. So it would be a truly insurance company. That's how it became an insurance. Blue Cross and Blue Shield became an insurance company who take care of the hospital and doctors' payments to provide a broad range of coverage. This is from the employers. This is from the employers from Southwest. Actually, Pacific Northwest, folks. Pacific Northwest. So broader employer-based coverage continued to exist through the Depression in 1935. During this time, National Labor Relations Act, so-called, it was a catalyst for employer-based health insurance. It was a catalyst for the employer-based health insurance. So the success of Baylor and the Blue Cross Blue Shield was effective and valuable benefit for the workers. So as I said earlier, Blue Shield was covering so Blue Cross and Blue Shield became quite popular in 1939. There were two key features in this. In 1939, there are two key features. One was a free choice of a physician. They can choose whomever they want. And number two, indemnity resident service benefit plans. Through this, doctors got reimbursed out of the pool, and the money and premiums were collected. The doctors and hospitals were reimbursed. So Blue Cross and Blue Shield companies working with Americans to access the health care became a part of their lives, folks. Even at that time, in 1950s, so-called HMO, Health Maintenance Organization, especially Kaiser plans started to originate. Now, after the World War II, folks, Kaiser plans, they started to do the same basic idea of providing hospital and physician payments. They had these Kaiser doctors formed finally a Kaiser Permanente. They started to own their own hospitals rather than taking them to different. So they started to own their own hospitals. That's how the Kaiser Permanente started in early 1950s. It is a similar model to provide a hospital and physician payments with a prepaid health insurance concept. It is important to understand, it is very important to understand what Medicare for all is. This is the time we need to look into it. What is the Medicare for all is? A lot of people talk about it. They're all eager to embrace it, but there are a lot of things you need to know before we can embrace, folks. And what those public options would be. We really need to understand what those public options are under the government subsidized, folks. This is under the government subsidized program, so everybody's eager to have Medicare for all, but we need to get into the nitty gritty of how the Medicare started. To understand Medicare, Part A, B, C, D, E, F, it is too confusing, folks. For folks who are elderly, I'm a physician, it is confusing for me. Can you imagine? I understand ordinary folks, ordinary employees when they retire, when they get retired, when they get this Medicaid, it's too confusing, too confusing. So, folks, you do need to understand the differences when you turn 65 and before you were 65, when you were covered under the employee health insurance. So there's a big difference under the employee health insurance plan and Medicare health insurance. There's a big difference, folks. So let's look into both the aspects. Employee health insurance was self-funded by the large employers. So they have more benefits, obviously. Whereas Medicare, let's look into it. So what it is, once you join Medicare, you lose all those benefits which you were getting it from the employer. That's a big thing. When you become a Medicare, you lose all your benefits, which not many people understand that. So when you're an employee, it's different from when you're a senior and going to get the Medicare card. So what are those differences, you may ask? Yes, let's look into it. Medicare, which was originally designed and developed, has significant flaws, folks. You guys need to get into this. It has significant flaws. Original Medicare has flaws. The fixed amount of money, so-called, when you prepay, you were supposed to get services paid for the hospital, doctors, everything, including the medications, everything. It's supposed to cover it all. And employer-based insurance plans did that because they were self-funded. What happened during this is during the World War II. In World War I, after the World War, there's a hyperinflation faced in Germany. And United States didn't want to go through the hyperinflation process after the Second World War. They had to encounter the hyperinflation pressures. They wanted to curb the inflation. America was bent upon holding the inflation at bay through wage and price controls, which were instituted during the time of the war, folks, during the time of World War II. Wage and price controls were instituted. Wage and price control during the World War II, many labor plants wanted to go on a strike in mass. In order to avert the strike, concessions were made to the labor groups. Concessions were made to the labor groups. So Labor Board exempted, watch this, Labor Board exempted employer paid health benefits from the wages. Well, if somebody says it all started by an accident during World War II to control the inflation, yes, it was an accident. And it also was a deliberate attempt by the labor board to avoid the strike. They made a deal with employers. So the wage and price controls, they wanted to add the benefits for the employees, but it will not go towards the wages. So how would you do it? By historical accident, they created a tax advantage for the employers. This is the beauty. They created a tax advantage for the employees, which drove enormous demand for the employer provided health benefits and the insurance plans. Prior to that, they were all individual health insurance programs, folks. They were all individual. They were not group health insurance programs. They were all individual health programs. So the individuals were paying the hospitals and doctors. Now employers started to pay hospitals and doctors through a so-called employer provided health benefits. But the trick was employers didn't have to pay taxes on that portion of the payment. So there was an exemption from the wage and price control during the World War II, folks. Employers received 100% of the tax deduction. Well, the benefits employee received were exempt from federal and state taxation. It was a great deal for the employees. Yes, because it was not considered as a part of the wages. So the employees loved it. They loved because they didn't have to pay from their pocket. But employers were taking exemptions from the federal and state taxes. So what it started in 1955, this health insurance coverage was so popular, by it was originally it was 10% of the population. Now it went up to 70% of the population by 1955, folks. 70% of the employed workers were receiving employer subsidized group coverage. Group coverage is not individual, group coverage. So the individual employee did not have to pay. So who would take care of this? Well, Blue Cross and Blue Shield was the only company then. They had the experience for 20 to 25 years since early 1930s onwards. They had the experience to handle these, processing the claims and all that. That was the only insurance company existed. So the Blue Cross and Blue Shield became a ubiquitous icons in both homes and medical offices across America, folks, across America. It became a dominant form of health insurance in 1950s. This is how the Blue Cross and Blue Shield became ubiquitous icons in 1950s, and they were the only insurance companies who could process the claims for the hospitals, doctors, and drugs, everything. It all included everything. They didn't differentiate any cost related to health, they covered it. So in 1959, the Congress acted a federal Employee Benefit Act in 1959. So the Blue Cross and Blue Shield responded with creation of Federal Employee Health Benefit Program. So the federal government got together and decided who to administer these programs. Then government only knew Blue Cross and Blue Shield. And the Blue Cross and Blue Shield was so ubiquitous. So they had no other choice but to give it to Blue Cross and Blue Shield to manage these employer federal employee health benefit program. That's how Blue Cross and Blue Shield evolved and became a dominant insurer at that point. Today, Blue Cross and Blue Shield still covers 4.8 million federal employees, folks, retirees and their families, even to this day. Then what happens next will be interesting to watch. 1960s. Well, to be exact, 1964 and 65, President Lyndon Johnson decided that old folks, when they retire from the employment, they had to have some type of a coverage. So President Lyndon Johnson came with a great society program for the people who, when they're retired from the employment, and also people who can't pay themselves, who can't take care of themselves. So-called Great Society program was started by Lyndon Johnson. What was the program? One was Medicaid coverage for the. This is during the civil rights movement, folks. This is during the civil rights. So President Lyndon Johnson, had two components to it: Medicaid coverage for the poor, from the low end of the economic cycle, that is for the people who can't afford, they came up with the Medicaid. And Medicare was enacted for the people who retired from the regular employment. So Medicare become a senior, enrollment. This is how this is where the government starts to get involved in healthcare delivery, folks. This is where 1964-65, during the Great Society, that's where the origination of Great Society program, that's where Medicare and Medicaid were formed. And who was the insurance company they selected? Obviously, Blue Cross and Blue Shield, the only company they knew. They gave the contract to the Blue. That's how the government got involved with healthcare and managing the healthcare through Blue Cross and Blue Shield to manage the Medicare and Medicaid. You can see now all things work together after the early formation of Blue Cross and Blue Shield and the expansion of employer coverage. Those days, you're talking about expansion of the employer coverage. So once the government started getting involved with health, so-called employer, Federal Employee Health Benefit Program, and Medicaid for. So the Medicare was the government program. So this is how Blue Cross and Blue Shield was well positioned to process the claims. And the government selected the Blue Cross and Blue Shield. In 1964, when they formed Medicare, 19 million seniors were enrolled. Once the legislation passed, 19 million seniors got enrolled, and Blue Cross and Blue Shield was the administrator of the Medicare. What happens is Blue Cross and Blue Shield, while they were administering these programs on Medicare, they came up with a program called Part A and Part B. What is Part A? Part A covered the hospital, so to administer easily. So they formed a Part A for the hospital, Part B for the physicians. So you may ask, what was the coverage of Part A and B under the government subsidized program which Blue Cross and Blue Shield was administering? You'll be surprised, folks. The original plan, which was passed in 64, 65, was a basic insurance. This is where the Medicare had a basic instrument. The basic insurance back then, what it means, basic insurance in 1960s, 1964 meant to cover hospital stay and surgeries with a dollar amount attached to the surgery. Whether it was a broken arm, brain injury, or something for your heart, it doesn't matter. Whenever the surgery was scheduled, those items were covered in the amount of money. That was the basic insurance, folks. That was the basic insurance, 19. So the maximum amount the Blue Cross and Blue Shield was paying with an individual diagnosis, they covered it up to 30 to 60 days coverage. 30 to 60 days, folks. As we move through, this is 90. That is again only to 30 to 60 days. That the entire coverage was 30 to, that was the basic coverage. In 1960s into the 1970s, there are other insurance companies started to develop between 1960s and 70s. Other insurance because of the technology and advancements. The other insurance companies started to develop and they wanted to compete with Blue Cross and Blue Shield, covering basic coverage. They wanted to compete because Blue Cross was covering only for 30 to 60 days. So the technology took over. The costs started to go up very rapidly in 1970s, folks. While the companies sold the same basic limited structure of scheduled coverage, most employers went beyond. This is where the beauty is. Most employers went beyond with the recognition, this is employers, went beyond with the recognition of higher costs that technology was bringing to the healthcare. They wanted to increase the coverage. This is from the employers, folks. They offered so-called supplemental major medical on the top of basic coverage. These are for the folks who are employed. New technology services and the hospitals stays, they got together and they wanted to do the same thing. So they introduced a deductible. Up to a certain amount, you have to pay. After that, they'll take care of it. So they introduced a concept called deductible. But the basic coverage of the major, including supplemental major medical, would cover you up to $250,000 expense. And many of the employers even covered up to $1 million. Up to $1 million. This is from the employers' self-insured plans. They will get the coverage up to $1 million. Generally, folks, whenever there is a legislation which we passed in 1964, legislation tends to crowd out of the future. This is well said by Ron Bachman. What does it mean? The legislations tend to crowd out the future. So what happens to Medicare, which locked in the plan of 64, is still the same basic coverage we have, folks. It has not been modernized. Do you think Blue Cross and Blue Shield offers the same kind of design to their employees today? Obviously not. Marketplace expanded the coverage same way the other employers did in 1970. So the supplemental major medical on the top of basic plan, they combined in 1980s and 90s. They combined basic plan and supplemental. This is when Medicare, this is where Medicare decides to come up with a strategy, because there are so many insurance companies competing each other. So they came up with a plan of giving the same premiums to the private insurance carriers. So they started reimbursing the private as a global fee to take care of the senior folks. This is how it originated. So what Medicare did, Department of Health and Human Services, 1980s. I've been there in the time, especially in 1990s. This is what happened. Medicare started to contract with the private insurance companies, so-called managed care. So same payment, whatever they were spending to the basic plan, they gave that amount to the private insurance. Private insurance companies were able to take care of these folks because private insurance companies were smarter. They were trying to handle the pressure from whatever the supplemental coverage did not exist in the bill. So what these private insurance companies did, they provided the supplemental insurance at no cost. At no cost. This is how the Medicare Advantage. So when the Medicare started subcontract with the private, became a Part C. So Part C originated by Medicare giving those contracts to the so-called private insurance carrier. This is how the Medicare Part C was formed. So that became a Part C, Medicare Advantage. So they were offering not only the Blue Cross, not only the basic plan, they were covering the deductibles, they were covering the comprehensive major medical coverages. So the private insurance carriers knew how to curb the costs. They came up with their own rules and regulations for the people who are enrolled into these so-called prepaid health plans. So Medicare Advantage is not your Medicare. It is basically you're giving up on your Medicare. you're being taken care by private health insurance plan. A lot of people, folks, don't get it. Medicare Advantage is not Medicare. I want you to get to that. Medicare Advantage is not your Medicare. It is a private health insurance taking care of you, covering all your costs. You really need to get to that. And what they do is once these private insurance carriers took over, they were receiving funds on a monthly basis. Their revenue started to generate, and they become very popular. These managed care plans in 1990s, they became so popular. Everybody, because people when they retired, they didn't want to face additional costs, and there was no comprehensive major medical coverage. So they had no other choice but to join Medicare Advantage. That's that's what it did it. Medicare Advantage in 1990s became so popular, and most of them decided to join and get additional coverage. But over a period of time, these private health insurance companies also got smarter. They started to have deductibles. What they did, they came with a deductible for physicians, deductible for hospitals, deductible for drugs, so medications, they all started to, because they want to curb the cost. The only way they could curb the cost by putting these deductibles up front, so that way they don't have to pay the upfront costs. The so-called Medicare Advantage plans did a good job. Don't understand, they did a good job. But the thing is, a lot of folks don't understand this Medicare Advantage concept, so-called managed care. I wish the original Medicare, which was formed, that can be modernized. I will come to that. We can modernize original Medicare. We haven't done that. So Medicare now A, B, and C. So what happens is the employers' demands evolved with technology and Medicare. So even with the private insurance companies and employers, they expanded the services. What happened to Medicare itself? It has not evolved. It is stuck in the same 1964 legislation, folks. It is stuck at 1964 basic insurance. That's why anytime you have a legislation in particular, crowds out the future, which means it limits the ability to change, adapt, and modernize. That's what I meant. That's what Ron Bachman meant. What it is, it limits the ability to change, adapt, and modernize. So we really have not modernized Medicare. This is where people, I would like you to get it, because you seem to think Medicare is great, but there are a lot of things we need to address in Medicare. So the modernization of Medicare Part A and B, and even government option, now it all start to make sense, because understanding Medicare being updated related to healthcare, now it makes sense. Medicare needs to be reformed in order to accommodate today's healthcare needs. It has not happened since 1964, folks. It has never. Only thing they have given up A, B, C, and I'll tell you about Part D. But original Medicare still remained the same. So the health benefit plan for the federal employees, including Blue Cross and Blue Shield. You'll be surprised, folks. These private employer groups expanded to 52 million members in Blue Cross and 40 million members in Blue Shield. It's amazing how private health insurance grew and they all expanded the services. Back then, the federal employees choose their own health coverage. They chose consistently Blue Cross and Blue Shield combined program. So they enrolled almost 33% of the federal employees as from 1916 onwards. So more competition today from private insurance companies like United Healthcare, Aetna, and even in Blue Cross, Blue Shield, they got split and they started to compete. Some of them became for profit, some of them remained non-profit. Every state had their own Blue Cross and Blue Shield. Even Blue Cross themselves started to compete with each other in different states. So Blue started to cross their own boundaries. Blue started to cross their own boundaries. So the Blues started to have the whole boundaries and they all started to compete. What is this about? In 2013, folks, in 2013, there's something else developed. Actually, 2006, I should say. 2006, Medicare Part D. As we talked about Part C, now Medicare Part D for the prescription drugs. It's a little bit complicated, but we'll get to that. But the Medicare Part D, employers partly finance the Part D. They didn't have any problems. And whereas in 2003, Medicare Modernization Act was passed. What is Medicare modernization? The way it worked out, folks, Republicans didn't go along with a plan for Part D coverage. They didn't have enough support in the Congress. So the Republicans had to embrace this health savings account legislation. So when they passed this 2003 Part D, Republicans embraced the idea of people when they retire, they should be able to afford to pay for their own medication. So they came up with a health savings account legislation, and that's how they were able to pass a compromised Part D along with the health savings account legislation. That was the Medication Modernization Act. But if you're on Medicare, you can't contribute to the health savings account, folks. This is prior to Medicare. People, before they join Medicare, they should save the money so they can have personal care accounts. The Republicans came to the realization if you have a prescription drugs, when people had their employer plan all these many years, now all of a sudden turn 65, federal government says, I'm sorry, we're not going to have a prescription drug coverage for you anymore. You're on the wrong side of history. That's how they compromise and they agree to Part D. If they didn't go along with it, they'll be voted out of the office, obviously. Look how long it took for Medicare from 1964 to 2004 to pass so-called modernization of Medicare. But still, it did not address the basic insurance coverage. So we have been talking about the Medicare background, history, how the Medicare was formed, and how Blue Cross and Blue Shield originated, how Part A, B, C, D, got incorporated. But the employer plan was still doing a better job than Medicare. Once they retired, the Medicare did not have many benefits. So they didn't like the idea of Medicare not providing those benefits. That's how Medicare came with a solution. It's called deductible, so-called deductible. So to compensate for people who are under the employee plan, they had better coverage. To compensate that, Medicare came with the deductible part of the Medicare. What is the deductible part of the Medicare? First, Medicare basic plan only covered hospital, physicians, and drugs. But there was a basic coverage. So when they came with this is where it gets a little complicated, folks. This is 99% of the Medicare beneficiaries do not have a Part A premium. So most of these employees have covered 440 quarters of Medicare covered employment. You have 40 quarters of 10 years of coverage. You do not have to pay any premiums for the part. It's a little get confusing. But in the Part A, if you stayed in the hospital, if you get admitted to the hospital, so Medicare came with the deductible. If you get admitted in the hospital, you have to pay. Today's rate is around $1,408, folks. That's your deductible portion for the hospital. And $352 after 60 to 90 days. That's another deductible. See, this is how they came up to cover the employees. So $350 for the 60 to 90 days. After 90 days, $704 per day. Between 60 to 90, $350 per day. So you have a maximum number of days, 150 days. So when you're under the age of 65, there was no limit. This is only for the people who are joined the Medicare, because Medicare came up with these deductibles, which many people could not afford it because they still stuck to the Medicare basic plan. So only way they can cover to equate with the employee coverage is to introduce the deductibles for the hospital. Even the physicians, the same way, they came with the deductibles. 20% across the board. You have to pay 20% of the cost. There's no reason you have to do that. That's how supplemental insurance originated, folks. The Medicare supplemental insurance started when the Medicare started to introduce the deductible. There is no reason that you cannot have a coverage with a little cost. But if you have a Medicare supplement, high percent of Medicare beneficiaries purchase the supplement to cover these costs. Phenomenal. To cover the 20% cost of the hospital admissions and hospital and physicians payments and everything, even including the drugs. So they had to cover. So they had to buy supplemental insurance. So people who retired, they bought a supplemental to take care of that 20%. So the Medicare supplement was a brainchild of Ron Bachman. He's the one how he came about this Medicare supplemental. According to him, when he introduced this Medicare supplemental, the insurance agents would go through the process and play the of fear into the elderly by saying, oh, if your spouse goes into hospital for 250 days, how are you going to afford it? How are you going to see? These agents started to put fear in the among the seniors, saying that, how are you going to pay when your spouse is in the hospital for so many days and there's no way you can pay this, $1,400, $350 after 60 days, and $700 after 90 days. There's no way you guys can afford it. That fear seems to be the reason why people bought Medicare supplemental. But the real thing is, Medicare supplemental Medicare would have covered it anyway without supplemental. So what happened with the supplemental? It stayed and it continued. Medicare could have covered. I'll tell you how Medicare could have covered without supplemental. But because of the fears, and seniors obviously don't want to go bankrupt from your healthcare costs, so that fear drove them to the either Part C or to the supplemental. Part C was Medicare Advantage, which is managed by the private insurance company, whereas supplemental was additional insurance on the top of what you already paid over a lifetime. If you're going, let me make it clear. If you're going to have a Medicare under the structure, it covered 365 days. I will tell you, it should cover. Why? Why would Medicare cover 365 days? I'll tell you why. Hospitals are reimbursed so-called on the DRG diagnosis, related diagnostic related groups. When you're admitted to the hospital, if we're given a diagnosis, federal government would reimburse a hospital a fixed amount of money to any hospital. Average number of days calculated in that payment to the hospital, right? That's what it is. So average number of days was incorporated in the diagnosis. If they cannot, patient stays in the hospital longer than hospital loses revenue. Once you have a diagnosis, they have to discharge and they will cover them till basing on their diagnosis. So longer days, hospital will lose the revenue. So the hospital payments were not based on the days, it was based on the DRGs. If somebody stayed 250 days, does that mean hospital is out of that expense? Of course not. Of course not. But these lobbyists and associations who created a loophole. What is that loophole? It's called outliers. If somebody stays in the hospital 250 days, they are outliers. These outliers got reimbursed differently than they just got fixed payment from DRGs. Outliers got paid more. So they benefited a lot more. Hospitals got paid more through the outlier program. Was outliers was lucrative to the hospital. So there was no reason to have this supplemental. They just put fears in the seniors. They drove them into the Medicare Advantage and they started buying this supplement. There was no need to do that. There was no need to have a Medicare supplemental. But that's what it is. You just lower the you just lower the formula for the outliers. That's all you needed to do. Then cover everybody for 365 days. You just had to lower the formula. It will cover 365 days for everybody. So nobody would need a Medicare supplemental policy, folks. I'm telling you, this is what it drives me crazy. It drives me crazy because these lobbyists in Washington know how to, and hospitals reap from outlier programs. And Medicare Part A, the other benefits, which are skilled nursing and home health care services, are there. They also have deductibles. But you do not have a different deductibles for skilled nursing in an employer-based plan. See, this is the problem. On an employer-based plan, there are no deductibles. Whereas it comes to Medicare, there are deductibles. So why do we have separate deductibles for employer-based and Medicare? Even the Part B, there's a deductible for the doctors, physicians component. If you're working and employer subsidized health insurance, you have a different deductibles on the top of this Part A deductible. You pay 80% to the plan and to put 20% of the beneficiary, all the additional costs are deductible from insurance. So in the employer plan, you don't have to pay 20%. Whereas only in Medicare, because it was in the basic health plan, which has never been modernized, Medicare still remains old-fashioned to the 1960s basic health plan, whereas the employers modernized it, advanced it, and started to cover most of the deductibles in Part A and Part B. There's no reason Medicare could not have a cap as well. You should have a cap of 250, like a 2,500, 5,000, even 10,000. There should be a cap. Even Medicare can do that. You know why there needs to be a cap? Because these senior folks are afraid that they're going to go bankrupt with unlimited life. So once you put a cap to the Medicare, 2,500, 5,000, 10,000, once you have a cap, then you're not exposed to unlimited amount of expense as a beneficiary. So Medicare recipients will not be exposed. That's one way to, if you really don't need a supplemental. You can get around the supplemental, but they need to modernize this Medicare. They need to put a cap up to certain limit so these senior folks can take that liability, that can absorb that. But when you have unlimited liability, it becomes difficult for the senior folks. So the legislation is hard to change, folks. It is hard to change. Reforming the Medicare is not going to be easy. It's not going to be expensive. Reforming the Medicare is not going to be expensive, folks. One thing I want, if since you were talking about Medicare for, it is not going to be expensive. It should not be expensive. And as per actuarial, Ron Bachman says, I've, he has gone through actuarials for the federal government for 50 years, folks. He says reform the Medicare is very easy. There is an alternative to Medicare Advantage, so-called this private insurance, so the middlemen, managed care, HMOs, health maintenance organizations, they are swindling lots of funds from Medicare. There is an alternative, folks. This is the beauty. This is where we need to watch out. There is an alternative to the managed care plans. So called right now, what Medicare is doing, Department of HHS, you're listening, you're giving the money into the wrong hands, folks. Wrong hands. Let me solve the problem for you. Department of HHS, Medicare Advantage. So-called Part C of Medicare. There's a Medicare Advantage program. That's where they pick up all this Medicare Advantage. Again, I told you they're not. It's not Medicaid. It is done by the private insurance companies. They join HMOs, PPOs, you name it, folks. Every Medicare beneficiary can check out. If you want to move to the Medicare, this is the beauty. What it does, Medicare Advantage, they entice you. It's because they want to get funds from the HHS. They want to collect the funds from Medicare. They even give you not only 365, they give you drug plan coverage, vision coverage, dental coverage. You name it, they cover it all. When I say Medicare can be improved, we can improve the entire program of Medicare. Only if politicians get together and consider there's so many things can be done to the Medicare. Politicians do not know what could it be, and if Medicare were to be expanded into the entire population, politicians don't know that, do not know if it could be expanded to the entire population. Surely we would make the changes. We have to make the changes which I have talked about. I do not think politicians would go there because they really do not understand so-called personalized health insurance concept. They do not understand that, which I've been telling you folks. Personalized health insurance, even the Medicare, even the senior folks like me, I should be able to use the funds from Medicare and buy my own health insurance, put money aside into the health saving. It can be done, folks. It's very simple. If instead of pumping the money into the private insurance company, because there's always a middleman, have administrative costs, you have billing. I'm talking about personalized healthcare with personal care accounts. You pay as you go. You pay as you go. This billing system needs to be gone, folks. Billing companies are, you know, everybody's making money in the middle. They're driving away the competition. There are all these mega mergers, hospital mergers, group mergers, you name it, which is going in the wrong direction. We need more competition. We need more affordability. We need more transparency. How and give the consumers the tools what they need. Medicare is an ideal vehicle where they can provide the tools for the senior folks to manage themselves. We have come this far. Medicare is easily be reformed if Politicians sit down and get together, come up with a plan where it doesn't cost the government a penny. It doesn't. It should not cost. You have to have a public-private partnership, folks. That's the only solution. Public-private. So that way, we're not talking about privatizing the healthcare. You're talking about public-private partnership. I hope you guys are getting it. When you have a health review board is a public-private partnership. There is there's no, you know, it is this health review authority has ultimate control on the insurers, on the facilities, you name it. They have the ultimate authority over the insurers and the applicants. Applicants, people who can't afford, they will give certificate of guaranteed coverage, folks. Certificate of guarantee. People who need the most care, health review authority will make sure, because that's the beauty of having a public-private partnership. I hope somewhere along the way somebody might listen to this segment, especially the politicians in Washington, D.C., and presidential candidates recognize what we have Medicare is 1964. 1964. And we were forced to take Medicare even today after, you're talking about 60 years. It's a simple example, folks. Like government is making you buy 1964 Chevrolet. Sorry, Chevrolet. In today's marketplace, that has heated seats, better engines, and has air conditions, radios, you name it, CDs, all the whistles and bells. But the government says no. This is what the response. Government says no. I'm sorry. You're going to have to buy 1964 Chevrolet. How about that, folks? Because government says that's all is on the table. That's all it is offered. We have no choices. There's got to be a different approach to Medicare. Since we are talking about Medicare for all, it needs to be reformed so we can get a personalized, consumer-driven healthcare where it covers everything and it is very transparent, affordable, and it should not cost $3.8 trillion, folks. It should not. When you talk about healthcare, once we address this health insurance reform, healthcare is going to be revolutionary, folks. Technologies on the consumer side. You guys need to realize telemedicine, telehealth, robotics, AI, which is in the consumer's favor. So you need to give the importance to the consumer. Put the consumers in the driver's seat like any other sector. We will bring down the prices. We will be number one in healthcare delivery, folks. Thanks, guys. I keep bashing the same old thing. Thank you for listening. And I love you guys. My passion is consumer driven, personalized healthcare. I want everybody, my goal is everybody to have personal care accounts irrespective of the socioeconomic. We don't need a class system, folks. We don't need a bronze, gold, platinum. We don't need a class system. Let's not go there. Let's treat everybody the same. Again, thank you. God bless.